who is deeply involved in all issues related to mortality and prevalence of diseases. We have Ricardo Martin, Managing Director of Johnson & Johnson in Russia and CIS, Medical Devices and Equipment. We also have Farhad Riahi with us, Global Head for New Partnerships and Models. And Evgeny Kamkin, the Deputy Healthcare Minister, will also join us today. Mr. Kamkin is responsible for the scope of his responsibilities providing health care to patients. So we'll try to look at the results of the fourth COVID stage, fourth COVID wave, and I will be very much interested to hear what our colleagues have to say about preparations taken to get prepared to fight with the new variant of COVID-19, Omicron. COVID-19 for all of us has become a black swan. That was a phenomenon that has dramatically changed all areas of our life. It was a major impact upon the way they live. It changed the way we work. It changed the way we look for resources. It has it forced us to completely overhaul the way to provide medical care, to provide drugs, make drugs available to patients. So it has created a completely new context for this, and it pushed us to innovate. So we came up with a lot of novel things. We developed new approaches to providing health care, and science was there to support us, and our scientists achieved a lot of success in providing us with assistance to fight with COVID-19. Mr. Kamkin, we are very much delighted to welcome you here, and I'd like to introduce Deputy Healthcare Minister. My first question goes to Ms. Kotova. She will tell us about the numbers for the Russian Federation of medical statistics. These numbers will help us better understand whether we managed to efficiently cope with the fourth wave. In 2021, the healthcare system had to adapt to the pandemic, and it had to transform itself. In 2020, the growth in infection rate was attributed to problems with cardiovascular diseases, and in 2021 there were also diseases related to lungs. So, Ms. Kotova, the floor is yours. Good afternoon, dear friends and colleagues. Talking about the contribution of these diseases to the development of our healthcare system, and looking at what we had in place before COVID and after COVID, I have to say that these diseases still take these are the largest contributors to the mortality rate. So these diseases are still the major cause of death, and they have this fact also has a big impact upon the life expectancy calculation. In previous 15 years, from 2005 to 2019, there was an upward trend in life expectancy, and this effect is mainly attributed to the fact that we have a smaller number of people dying from cardiovascular diseases. Coronavirus infection has thrown us back. Actually, it has thrown us off the track of this upward trend. In previous 15 years, for 8 years in a row, life expectancy in Russia was increasing. So we gained a lot of momentum here, but COVID-19 pandemic has thrown us off this trend. But at the same time, we can say that even during at the height of the pandemic, the diseases related to blood systems still contributed a lot to the mortality rate. These diseases, if we look at their place in the overall structure of diseases, we'll see that these are the most widespread category of diseases among among adults. So, prevention measures, improved diagnostics, timely diagnostics of these diseases, proper support of the treatment process at all stages. All these things are really important. I completely agree. Ms. Kotova. And cardiovascular diseases and circulatory diseases are really important categories. And they still remain the Achilles' heel of our healthcare, and we'll keep focusing on them. And these are the key mortality drivers. In 2020, these diseases accounted for 44%. In 2021, they account for less than 40% of the mortality rate. But this is not because we have less cases. That's because we have more COVID cases. And this is something that will define our organizational efforts, so those things that we do to address this problem. And in 2021, and actually not just in 2021, but just during this COVID-19 pandemic, we started thinking that we may put it behind ourselves sometime. But it's a really long-term trend, and probably this coronavirus is here to stay. And our regional healthcare systems, or local healthcare systems, had to adapt themselves and had to transform themselves following this push from the pandemic. We looked at the so-called transformation index, and this is the index that we calculate to track the efforts of regional authorities focused on transforming their healthcare. So these numbers are telling us that we had more or less well-organized healthcare system. And increased life expectancy, reduced mortality rate from circulatory diseases and cardiovascular diseases. These numbers indicate the same. And I would also like Mr. Kamkin to tell us about the measures taken by the government, the measures which helped alleviate this problem. And I'm talking about providing drugs to patients. I'm talking about establishing a practice of medical checks and deep medical checks. And we know that for 20 or 30% patients who had COVID-19, after they get cured, their problems do not end. And there is data that shows that COVID-19 has an impact upon the heart activity, has an impact upon myocardial. So, Mr. Kamkin, I would like to ask you to tell us more about the projects that you currently have in place, focusing on telemedicine, providing medical services, and extra care that you are taking about patients in hospitals now. Talking about cardiology, COVID-19 pandemic highlighted the need in more doctors, and because cardiology highlighted the need in better training for doctors, because we had a point where we had to retrain our cardiologists to work with COVID-19 cases. And that means that our doctors need to have better competences and more competences. So all these things need to get a push from us. And I would also like to mention that over the last 2 or 3 years, our regional authorities were focusing on developing their risk mitigation centers. COVID-19 patients, some of them, need intensive care and observation. And this is something that needs to be ensured for them. And so, some of these things were addressed through making organizational changes in our healthcare. So this COVID-19 pandemic requires, or the effort to stop it requires huge participation from the state. And state authorities are playing heavier roles here, and in many countries. And it is related to improving the sustainability of our population. And I would like to ask Farhad Riahi from Novartis to share the new things which Novartis is doing in this area, like controlling risk factors, tracking populational health, and establishing interaction between state authorities and business.
Thank you very much. Thank you, Professor Shlyakhto. Hello, everyone. It's an honor and a delight to be here with you today to discuss this topic of cardiovascular disease and what we can do to help improve outcomes more quickly. Let me, of course, start by saying that this is as you know, a complex condition with multiple risk factors involved. Nobody in the world really has the solution to it yet. So there is a lot to share with each other and to learn from each other. I was actually working as a clinician in Canada over the Christmas holidays in my urgent care center there. And I fully appreciate the point that Ms. Kotova made earlier about life expectancy trends that were improving before COVID, and now, because of the strain that COVID has put on the system, are falling back. I think that's true in other countries as well. And certainly what I see clinically on the ground is how much our care for other diseases has been affected by the COVID pandemic. At the same time, what's also happened is COVID has, as you mentioned, really accelerated the pace of innovation and the pace of adoption of innovation. This has happened in previous pandemics as well. It's happened in previous health emergencies. And I think we should use this opportunity. We should use this sad opportunity, if I can call it that, to improve and strengthen the health system for the future. One of the things, as I look around the world at the different partnerships that we have in the different countries that we are working in, and I think about what it takes to improve outcomes, one of the things that I think much of the world needs to learn from Russia is the importance of setting clear goals for what you want to achieve. And the goals that you have stated for improving life expectancy in a very tangible way are very important for that. So that's something that I wish other countries would do more of and would learn from you. In terms then of innovation and partnership and what we're seeing around the world, one of the first questions is, for a complex disease like cardiovascular disease, where do you start? Which aspect of it do you try to fix at a population level? Right? At an individual level, of course, every physician will always try to optimize all the care for their patients. But at a population level, where do you focus? And this is where I think having goals the way that you have is really helpful, because we can then think of the different risk factors involved: smoking, hypertension, dyslipidemia, diabetes, other risk factors, and ask ourselves, how big is the problem? How much of a contribution is it making to the problem that we're trying to solve? How much would solving it actually get us closer to the goal and to target? And then how feasible is it to make that change, both in terms of technology, but also in terms of human resources, and of course, in terms of money, right? So I think this is a question that many countries are struggling with. And you look at the prevalence of smoking, hypertension, dyslipidemia, and you ask yourself, well, in our country, which one is the greatest? Which one is the one that we can make changes? And what would it take to do that? In terms of medical care and sort of innovations there on the medical side, but also on the technology side, and the two are related. One observation from around the world is, if you look at the burden of cardiovascular disease, no country has enough cardiologists for all of that to be managed by the specialists. That's an unfortunate reality. So the question is, what is the role of primary care? And the two things that we are seeing that I think are interesting are, number one, the overall upskilling of primary care and family physicians and general practitioners to better manage cardiovascular conditions and the risk factors. So, Canada for a long time had the Canada Hypertension Education Program, which was cardiologists helping family physicians better manage hypertension and getting more of that care delivered in primary care. So that's sort of a general model. Some countries, the UK, Australia, Canada, are also developing, what in the UK they call general practitioners with a special interest. So family physicians and primary care practitioners who have more training in the management of, for example, cardiovascular disease or respiratory disease to manage COPD or diabetes, for example. So a cadre of family physicians who can then serve as the local, more trained practitioners to manage the very prevalent conditions in their communities. And of course, in very big countries like Australia, like Canada, of course, Russia, which is the biggest, this is quite helpful for populations where access to specialists is harder to get to. And then alongside that, I see four very exciting roles for technology to help this shift. The first one is actually in finding patients, right? So how do we find the patients who are at high risk of a cardiovascular event in the next few years? And how do we find the patients who are just about to develop one of the risk factors and we can intervene early to make a change? So again, in the UK, it's possible now for the NHS to analyze data from the electronic health records held in GPs' offices, obviously with their permission and with privacy in place, but to quickly access that data, clinical data and lab data, and find the patients that need more careful attention quickly, and alert their family physician, and again, involve specialists where necessary. The second role for technology is to actually help people themselves understand and engage with their condition, right? So, maybe I have high lipid levels. Maybe my blood pressure is high. I don't particularly care. But if I have something that tells me that in the next 5 years, I have a 20% chance of having a stroke and not being able to talk to my children as a result of that, I will pay attention. I'm more likely then to seek help and to change my own behavior. So I see a big role for technology in better getting patients to engage with the healthcare system and the support that we can provide. Connecting physicians across specialty and primary care not only when people leave the hospital and go back into primary care, which we all know is a big problem. But even getting specialist help. So one thing that COVID has done, for me actually in my non-Novartis clinical practice, is we can now get a mini consultation from a specialist by email. So instead of making the patient wait for 6 weeks, we can ask our question, send the right file, give the specialist access, and just get their advice and guidance on, do I change the medication? Do I order a new diagnostic test? And this really helps. This improves how patients are taken care of, and it improves the efficiency of specialists as well. And finally, the role of technology in tracking performance. So, my favorite example for this is Kaiser Permanente in the United States. They started this many years ago, where you can look at the entire population on your screen and see what percentage of them have what risk factors, and whether those risk factors are properly managed and controlled. Are they a target for blood pressure? Are they a target for lipids? Have they quit smoking? Is their diabetes managed? Across the population that you're taking care of. And where that isn't the case, then you can focus and intervene. And that I find really important, because it brings us right back to my first point about objectives. What are we trying to achieve? And one of these big roles of technology is in showing us where we are relative to what we're trying to achieve, and how we then course correct to get there on time or even faster. So I'm in this privileged position at Novartis, where we are partnering across the world with healthcare systems on different aspects of these things that I've laid out. In spite of all the difficulties of COVID right now, I'm actually optimistic about the pace of improvement in healthcare once we come out of this latest wave. And I'm looking forward to partnering and improving care for populations in Russia and across the world as quickly as possible. Thank you.
Спасибо большое, Farhad, за...
Thank you, Farhad, for that wonderful presentation on innovations. Listening to you, we understand that troubles lead us to innovations and new approaches to how you organize healthcare. All new things are well-forgotten things, and you have approaches to integration on the multidisciplinary level, from the first aid to rehabilitation, and this is something based on digital and IT is being integrated into the practice. Now, I would like Mr. Ricardo Martin from Johnson & Johnson. What Johnson & Johnson has in terms of innovations, and how the new high-tech change the paradigm on extending the life expectancy and the rate of death from cardiovascular diseases.
In this online format, which is only second best to presential. This is my 7th year living in Russia with my family, and I'm representing here Johnson & Johnson in the country. Last year was our 30th anniversary, creating deep partnership with the healthcare system to help and serve doctors and patients better. I want to take this opportunity before we start to thank all the doctors and nurses across the country, not just those doctors and nurses working in the red zones of the country, but those that are delivering what we could call conventional care. It's really thanks to them that hospitals have managed to keep open, a unique situation across the world, I have to say, and provide care to patients that in need. Today, we're not just fighting COVID, as was said before, but we're fighting all the consequences it's leaving in its aftermath. In that sense, special gratitude to the organizers of the Gaida Forum for including this very important topic in the agenda. As we know now, people with COVID are not just, people with cardiovascular disease are not just at a higher risk of severe disease from COVID, but also we understand now that COVID acts as a catalyzer for cardiovascular disease, for heart disease in particular. Heart arrhythmias had been detected in 1 of 5 people who have suffered COVID, pneumonia hospitalizations, related hospitalizations, and experts indicate to us that over 85% of people who have suffered COVID experience abnormalities in the heart. And so this means that the already challenges we were facing in fighting cardiovascular disease are getting more serious after the pandemic starts. What is the hope and what is the optimism in this is Russia has a tremendous track record of performance in cardiovascular disease. Professor was indicating that just before the pandemic starts, around 1 in 2 deaths in the country were related to cardiovascular disease. But I want to go back to 2005, where I think the mortality rate was about 850 per 100,000 inhabitants. And just before the pandemic, it came down dramatically to about 580, which is really a huge achievement. So that, together with the new high-tech care that exists, is a kind of possibilities that can give us an opportunity to serve these patients and to extend and consider extending more care to them and to improve their lives. In Johnson & Johnson, we have a unique opportunity to observe trends and not just trends, but also best practices across the world. And certainly one that pops up very clearly is that of prevention. And it's specifically secondary prevention in the form of care. Particularly in the case of cardiovascular disease, a great example of secondary prevention is the early detection and treatment of heart rhythm disorders, specifically atrial fibrillation, but all heart rhythm disorders, through, for example, navigational radiofrequency ablation. This is especially important and interesting in Russia because today we have around, and there's not a clear log, but it's estimated that around 2.5 million people suffer from atrial fibrillation. This is not unique across the world. We can call this a new endemia of atrial fibrillation. But 2.5 million people suffer of this condition, and about half of them, are non-responsive to drug treatment. And so this means that they are at a heightened risk of ischemic stroke, heart failure, up to 5 times more probability of suffering this type of adverse events. We also know that radiofrequency ablation can reduce relapse frequency for these patients from 36 to 10%, which is a huge opportunity for them also to not just regain normal lives and to become more economically and personally fulfilled in society, but also to reduce their risk of ischemic stroke or heart failure by quite a high level. As I mentioned before, there's a great experience in Russia around setting bold targets, decisive, brave action to reach them. And in that sense, the opportunity in atrial fibrillation is around the level of access that exists today. Approximately 90 ablations per million inhabitants are occurring at the moment in the Russian Federation. This is represented to about 2.5–3% of the incidence of the incidence rate. Czech Republic, which is a country I like to compare with because it's pretty close to Russia in terms of economic development trajectory, is today 3 times higher, 270 per million inhabitants. And so according to our calculations, if we could reach these levels of 270 per million inhabitants, this would not just save thousands of lives, but it would also create the opportunity to get closer to reaching, to gap that very aggressive target, an important target that we have in the programs for cardiovascular disease. Not to talk about the opportunity here to give back to these thousands of people a normal livelihood, and also we have to factor in the economic cost here of continued drug treatment, and in some cases, in the case of Russia, the pensions, that's of disability pensions. So this is one of those cases where increasing care actually has a very high return on society and on the economy, because this could unlock additional care and, of course, could unlock additional opportunities for these individuals to return to their normal condition. Talking about high-tech medical care, I believe it's no news. It's such a success program, the High-Tech Medical Care 2 program in Russia. It's literally saved millions of lives, and I think this is an example for all the world. And in that sense, it's going to take this type of bold, decisive energy and action, I believe, as we set our targets, as we set our sights on achieving the targets for the cardiovascular disease, it will take this type of bold action to reach. I believe we can achieve it. I'm convinced we can. And in that sense, we are very eager to partner and with every stakeholder in the healthcare system, continue our partnership to also share our extensive international experience. Thank you very much.
Спасибо большое. Мы абсолютно с вами согласны, что действительно инновационные технологии.
Thank you so very much. We are really sure that the innovation and bridging the gap in innovations would allow us to be ready for using new technologies in our clinical practice. Evgeny, so we didn't touch upon the primary health care. We don't understand that this success on fighting any non-contagious disease is about primary health care.
Yes, and before we start talking about primary care, I want to pick up from where other speakers left. COVID-19 has greatly pushed the pace of tech development, and we have accumulated a large data set about health of our population. So using predictive analytics will help you develop completely new approaches to primary care. And well, we believe that virtually all people have access to cutting-edge means of diagnostics, and primary care, doctors from the primary care system is the first point of contact for these patients. So if we want to reform the whole thing, we should start from there. Our country is investing a lot of efforts into renovating the infrastructure for medical care. We should support these efforts with some organizational efforts as well. So on the one hand, we have to get our people more conscious about their health. So they've got to be more mindful about the impacts of various factors upon their health. And then we should use the information that we collect and information about health of virtually all our citizens. On the basis of these data, we should develop targeted programs which will be used by our general practitioners in their therapy courses. And I do hope that this data will help us become more efficient in terms of caring after patients with chronic non-communicable diseases and cardiovascular diseases in particular. These services can help us provide seamless experience to our patients. And that's very important. Just the fact that it is a seamless process makes it easier for our people to use it. And apart from that, it is very important to focus on risk groups. I mean, groups of patients which are more likely to develop these diseases. So as I have said before, we have data on the level of health of all our citizens, and the availability of this data can help us prepare tailored programs. We can analyze our entire population and single out particular groups of people who have higher risk of developing the blood circulation diseases. We can properly break down this entire number into segments, like people who had cardiovascular diseases, who had complications in the form of cardiovascular diseases. And this is one of the ways to adopt a targeted approach to this. And if we make this information available to doctors, it will help them. It will help doctors to provide better service to their patients. I find it very difficult to disagree with this. Thank you. And I would like to ask Mr. Kamkin to wrap our discussion up and also give us some highlights regarding what Healthcare Ministry plans to do in 2022, what should professional community expect from you, and what do the patients stand to get. Thank you very much. And first, I would like to thank our speakers today. I would like to thank our English-speaking speakers as well for participating in this discussion. We have already mentioned that cardiovascular disease are the point of focus for us. Even regardless of the fact that pandemic has thrusted to the COVID-19 has thrusted to the top of our agenda. However, cardiovascular diseases and blood circulation diseases remain the key contributors to the mortality rate. So I think we managed to avoid a peak in death rates in the group of patients which had a combination of COVID-19 and cardiovascular disease or blood circulation disease. And this effect is partially attributed to the efforts that we invested in reforming our healthcare area in 2019. As part of this effort, we developed a regional program, a local program, focused on combating the spread of cardiovascular diseases. Those programs were tailored to the specificity of our regions. We have provided more equipment to our hospitals. So over 500 hospitals have received modern equipment, allowing for better treatment of cardiovascular diseases. We have provided extra training to these doctors. Another important point is making drugs available, ensuring availability of drugs for those patients who have already gone through an acute case of a cardiovascular disease. And in order to avoid further complications, these people need to take certain drugs. We are making these drugs available to them. So we are keeping this treatment course available for them. We are expanding the scope of this program now. We expect it to cover a broader range of patient categories. Coronavirus has altered our agenda, so to speak. And coronavirus as a disease has consequences, and patients may develop complications. They may develop complications sometime after they get coronavirus, and this risk is higher among the patients with CVDs. And we are currently analyzing we are currently doing the medical check for patients who already had COVID to see what other systems of their bodies have been impacted and whether they are in need of medical rehabilitation. So we have the capacity to do this now, and I hope that this year those citizens which have to go through a deep medical check, and the primary group for this are those who already had COVID, so we hope that they will be able to go through this detailed medical check, and we will collect more data on the state of their health and the impact that COVID has on them.
Современных вакцин мы являемся лидерами по производству и по разработкам этих вакцин.
And Russia is a leading country in terms of both developing vaccines and manufacturing vaccines. Availability of these vaccines helps us to curb the spread of these diseases. And so this So we have to focus on certain groups of patients, and we have to ensure that medical rehabilitation is available for them, so that we avoid further complications.
Это и формы дистанционного мониторинга состояния здоровья, и формы
So we have touched upon various other factors today. So we have plans to carry on working with these patients. We have plans to start certain social initiatives, and one of these initiatives is about providing so-called medical assistance. This is when you get a device which monitors your health parameters, and that eliminates the need to go and personally see a doctor. So we are going to embrace this practice and embrace this technology, and we hope that this technology will help our patients to become more consistent and become more mindful about their health. It will also help us become more accurate in our treatment. So we have real ambitious plans here. And I do hope that we have enough time this year to finally implement these plans. And after implementing them, we will achieve the target set by our president, which is bringing life expectancy above 80 years here in Russia. Thank you very much, Mr. Kamkin. And it was a very detailed and substantive wrap-up.
Конечно,
There is one thing that I would like to say. COVID-19 was a stress test for our system. It pushed us to innovate, and it made us look into the benefits provided by digital transformation. And I think our success here will be driven by the speed at which we adapt to all these changes. And I know that our healthcare ministry is focusing on implementing vertically integrated medical assistance system. I hope that in 2022 all our regional medical systems will be connected to this, and that will give us better transparency in terms of treatment, in terms of patient's journey, and it will be part of our efforts to embrace the patient-focused or patient-friendly approach. This is our key thing for 2022. And you mentioned these personal medical assistants, and that's an important point. And I think this COVID-19 pandemic has highlighted the significance of big data. Big data has actually become a very significant impacting factor. We have medical companies which don't operate hospitals, just operate medical records and medical data. And just by doing so, they create a lot of value. I don't think we will be able to cope without this. So thank you very much, ladies and gentlemen. Thank you for this discussion, and I do hope that we have created some value here by making sure that our, let's say, patients see the light in the end of the tunnel. Thank you so much, and this is the end of our panel discussion here.